Hey, Dr. Islam over here. So we're going to talk quickly about Sublocade and its benefits and who does it work best for. Sublocade is a long-lasting or extended release buprenorphine product. Okay, usually it's done in a shot that we place a deposit or a depot right underneath the subcutaneous tissue into the fat, and it will harden up over the next 24 hours, slowly releasing the buprenorphine over the month. They come in 300 and 100 milligram dosages. Okay, very typically, this is what's typically recommended: is 300 first month, 300 milligrams the second month, and then 100 milligrams the third month. That being said, you first have to be on some sort of buprenorphine product for at least a week before you're going to be able to transition onto a Sublocade shot. When we're placing patients on Sublocade, I will tell you guys that it may differ from patient to patient, that if you are on a dosage less than 8 milligrams, from atypically, this is not typically what's recommended or typically done, because it's just a standard, and every provider has its own way of practicing. But I typically notice that if you're underneath 8 milligrams, you do not start. It's best to start not at the 300 milligram shot and go straight to the 100 milligram shot. That said, even still, with some patients, they may do a 300, another 300, and may have to do two, instead of 100 milligram the third month, they might have to do one or two more 100 milligram shots, meaning a third, fourth, or fifth month of the 100 milligram shot. Also, on top of it, especially in the first month, it may be that some patients may need to have some extra films, as so to help their little bit of cravings or a little bit of withdrawals that they're having in the first month of being on the Sublocade. Just they need that little assistance of Suboxone or Subutex, just to kind of get them over that edge. But by the second month, you're pretty much good to go on that. Very typically, it's usually done around the stomach area. Put a little ice pack, a little cold spray, and inject the deposit of the Sublocade. Some things that can happen: you can feel nauseous, can get constipated, just typically because it's a opioid agonist antagonist. But you can also have some redness at the site of the shot. Sometimes it may be that the area may get swollen, and if we need to take it out, within the first 7 to 10 days, we can incise it out or whatnot, because it's becomes a little hard deposit. Outside of that, it's a great medicine for people who have a busy lifestyle, who, once again, are ready to transition, who are having a troubled time transitioning off and tapering off of any of the buprenorphine products. The one downside with it is its cost, but for majority of patients, it is well worth it to pay that cost difference and to have the quality of life going on forward. If you have any questions, please reach out to our office. This is Dr. Islam. All right, take care, guys. Bye.